Here we are, a few years after the height of the COVID pandemic, and it feels like the dust is finally beginning to settle. COVID is still around, silently mutating, but life largely resembles normal. We have vaccines, better treatments, and masks ready for the next spike in cases. Yet, there's a feeling that we still don't know the full story of COVID-19. So let's dive into some lesser-known facts. COVID-19, caused by the SARS-CoV-2 virus, emerged in late 2019 and rapidly spread, causing global illness, death, and shutdowns. It touched every aspect of our lives, from the economy to education and health systems. Scientists and governments moved quickly to understand the virus, develop vaccines, and manage the crisis. Amid this chaos, some interesting information about the virus didn't make headlines. Let's explore the virus itself. SARS-CoV-2, part of the coronavirus family, can stay in the body longer than initially thought. Viral remnants have been found months after recovery in organs like the lungs, heart, and brain, raising questions about long-term effects. Many people recover from COVID-19 with few lasting effects, but some experience lingering symptoms like brain fog, fatigue, and severe health issues. Long COVID can affect even those with mild initial infections, possibly due to an autoimmune reaction. COVID-19 has impacted the natural world in unexpected ways. Lockdowns allowed wildlife to return to urban areas and reduced pollution, but conservation efforts were disrupted, increasing poaching and causing ecosystem imbalances. Isolation and fear during the pandemic drove anxiety and depression, but COVID-19 itself might have neurological effects. Some patients report cognitive problems, possibly from brain inflammation or psychological trauma from surviving the pandemic. COVID-19 affects blood in subtle ways beyond clots in severe cases. Some patients experience symptoms like cold extremities and tingling for months, possibly due to microclots that are hard to diagnose and treat. The vaccines were a scientific breakthrough, using mRNA technology for the first time in widely distributed vaccines. This technology could revolutionize vaccine development for diseases like cancer, HIV, and the flu in the future. Vaccine hesitancy has been significant during the pandemic, driven by rapid development, changing guidelines, and historical mistrust of the medical establishment, especially in marginalized communities. Public health must build trust alongside scientific advancements. COVID-19 is not just a health crisis, but also an economic, social, environmental, and trust crisis. We've learned much, but there's still a lot to uncover. Though no longer the top headline, the pandemic's effects will linger for years. As we move forward with caution and optimism, we must remember that the pandemic is far from over. It's just changing shape, and understanding its full impact will take time.